So what do you call yourself? Welcome to the LaTangela Show.
Hey. Hey, what can I do for you this fine day?
This is your destiny. Hot, hot, hot.
Right now.
Welcome to the LaTangela Show.
Kick it.
Come on in and enjoy yourself.
Right now.
We gon' party like no one else. Welcome to the LaTangela Show.
Admit all. Dr. Hempstead, how are you? Hey, V.
Hello.
Hello. How are you?
I'm okay, thanks. How are you?
I am excellent. You know, as well as to be expected. It's not Friday yet. We're not close enough to payday, but you know, life, Doc.
Hey, you got to take what you can get, right?
Absolutely. What part of the world are you chiming in from today?
New Jersey.
Oh,
yep.
Well, welcome to the deep South.
Well, thank you very much.
You begin to open outside all the way up and you make a field trip to Louisiana. Just know that I am your official tour guide.
I haven't been in a while. I've only really been to New Orleans, but I miss it. It's very, very nice.
And it's time to
I could go for a little Cafe du Monde beignet right about now.
Yes.
And
you know what?
Oysters.
We can always say it's research purposes because you're the doc with all the stats and all the happenings.
That's right. We should absolutely do that. That's a good idea.
You know, I appreciate you so much for taking time out of your schedule. I know that you're busy as the senior policy advisor over with the Robert Wood Johnson Foundation. That's a heavy title, and I would appreciate it if you could just break that down for us a little bit. Exactly what does that work like for you on behalf of the Robert Wood Johnson Foundation?
Oh, sure. Well, the foundation is a really exciting place to work for. It's the country's largest philanthropy that's devoted to health and healthcare. And we think about that really broadly. So we're not just interested in what happens in doctors' offices and hospitals, although we are interested in that, but we think about all the different conditions that contribute to health. So we think about housing and the environment, nutrition, economic supports, and all the things that allow people to live a healthy life. And we like to talk about a concept called like health equity, which means sort of an aspiration that everybody, no matter who they are, has a fair and just opportunity to live the healthiest life that they can live. So that's sort of writ large. That's what the foundation is about. And we have different teams, that are devoted to different particular areas like kids, communities, healthcare, et cetera. In the policy department, we do some sort of cross-foundational stuff as it pertains to state and federal policy. My own background is really about health insurance and sort of healthcare reform in general. So mostly I'm talking about coverage, Medicaid, the marketplace, employer coverage, sometimes Medicare, drug prices, stuff like that.
And, and it's important to get that information out, right? Knowing that someone is so concerned that they're doing the prior preparation to help equip us as we're making decisions, because usually we don't think about health insurance until we need it. And then you'll find us behind the 8 ball a lot of the times. But when we start talking about the research that goes into it, preventive methods are so important because some of it we're born with, right? Genetics. You can't beat it even if you try to in most cases.
Mm-hmm.
And education is key, but the education, unless you implement it, is just null and void. And with all of the factors, dear Louisiana, we rank the best of the worst in so many different areas. And it's almost like it's a setup from jump. We celebrate everything with food. If it's a marriage, if it's a death, it doesn't matter, right? But if we're not doing it with the thought of saying, I am trying to do this to live the best quality of life in spite of it all, we need to start having those conversations and normalizing that. And that's why getting you in the hot seat and on the tan line really helps us out. When you start talking about policies and procedures, we typically don't see that until someone on the other end of our vote kind of navigates through those waters for us. And dear life right now is a political season. So what are some of the things that we should look forward to in knowing that the policies are working on our behalf?
Well, I think the big policy thing that we're really trying to talk to folks about right now is what's going on with Medicaid, because, and this is something that your listeners might be interested in, because during the pandemic, the federal government kind of changed the rules and gave states more money. Medicaid's kind of a federal state program, and the federal government gave states more money and told states to stop doing annual eligibility redeterminations in the Medicaid program so that more people could be connected with coverage during the pandemic. Mm-hmm. And it was a good idea. And, more people enrolled in Medicaid and nobody disenrolled because the states didn't go through that annual process of seeing, are you still eligible or not? Now, the pandemic has, subsided, although COVID is still definitely a thing that people need to be careful about, but the official public health emergencies ended. And so now the federal government has sort of told the states, like, okay, it's time to start going through like 3 years worth of enrollment and redetermining eligibility for everybody. So every state's going about it in a slightly different way, although there's some best practices, and states have slightly different timelines of when they're doing it. But it's a really big deal because there are a lot of people that are going to lose their Medicaid eligibility. And
wow. What does that look like? Once they lose it, what does that look like then?
Great question. It sounds in a way worse than it is. So I kind of want to scare people a little bit, but not too much, or scare them about the right things. Some people are going to lose their Medicaid eligibility, but it's okay because they already have coverage from a job. Like imagine somebody who, during the pandemic loses their job, enrolls in Medicaid, then they get a job, they get employer coverage, they start using it, but the Medicaid agency has never gone through and sort of terminated them. So now they're going to, and it's kind of not a big deal because they already have other coverage. For lots of people, that's going to be true. So it's not like 15 million people are going to become uninsured. That would be a huge disaster because the whole uninsured population is only 30 million. I mean, I shouldn't say only, it's a lot, but if you added 15 million, that'd be huge. But so for many people, it's not going to be a big deal, but some people are going to lose their Medicaid eligibility and not have another source of coverage. Now, what can those people do? Well, most of them could either take an offer from an employer or a spouse's employer or a parent's employer, or they could go into the marketplace, healthcare.gov. And
okay, now you know what? And I love the fact that you said, or they can go into the marketplace and look at it, because if we start looking at the unemployment rate, especially as you're breaking it down state by state, chances are when you get to those states with a higher unemployment rate, they can't use that and say, I'm going to use my employer's insurance. So now how do they subsidize that? Knowing that they may have to come out of pocket, they're unemployed, but still need to be insured.
Well, yeah, I mean, if people are unemployed, I mean, that's a good point, because if people are unemployed in a state like Louisiana, which did expand Medicaid eligibility to people with low income, and some states near you didn't, like some states like Alabama, Mississippi didn't do that. In those states, you pretty much have to be pregnant, disabled, blind to be on Medicaid. But Louisiana expanded Medicaid eligibility to low income, non-parent adults. People that are unemployed and have no income probably won't lose their Medicaid eligibility. They'll probably still be eligible. So, that's sort of the good news for them. People who have an income that's too high for Medicaid, but still pretty low and don't get an offer from an employer can go into the ACA marketplace, healthcare.gov. Some people call it Obamacare, but the individual market. And lots of those people will be able to get pretty generous subsidies, so that their premiums will be subsidized. They may qualify for very low cost sharing, and it won't be as cheap as Medicaid, but it's theoretically affordable. So there's two things to kind of watch out for. One is if you lose your Medicaid eligibility, connect yourself to the coverage that you're eligible for. Don't fall through the cracks and become uninsured. The other thing to worry about is if you really are eligible for Medicaid, but you don't pay attention to these messages you're getting from the state, and you don't return forms and you don't update your contact information, you will get terminated, even if you are still eligible. And that's something that we really want to avoid. And that's one of the reasons we're out here talking to people, so that your listeners will listen and say, oh, okay, I better be on the lookout for some information. States are contacting people in different ways. A lot of states are trying to do things automatically if they already know information about you from like SNAP or something, and just do it. But you can't count on that. Right. And if you get a big blue or yellow envelope in the mail that says, you know, Louisiana Department of Human Services or whatever, said, don't throw it in the trash, you know, deal with it, because it may be that you need to fill out that information to stay enrolled in Medicaid. So we, you know, we don't want people to lose their eligibility that are still eligible, and people that do lose their eligibility, we want them to be connected to coverage. So that's kind of the deal with that. And, you know, it's a lot of people. So it is important. Now, if you lose your Medicaid eligibility because of not filling out paperwork, you can get back on, you know,
but it's just a process, a waiting window.
Yeah. And you might not be able to pick up your prescription. You know, you might go to a doctor's appointment and they won't see you, and you could interrupt your care. So like, nobody wants that to happen. So,
right.
You know, it's important for listeners that are, and see if you have listeners that have been enrolled in Medicaid, but only for a couple of years, they've never been through this eligibility thing before. So they're not thinking about it or expecting it. It's not like, you know, you kind of know you have to register your car and stuff like that, but you might not have any historical knowledge of this if you're kind of new to the Medicaid program. So that's another reason that, you know, and unfortunately, a lot of people don't know this is happening, which is, you know, dangerous. So it's
and they are doing a lot to get the messaging out there too.
Yes.
And just hearing it is one thing, but hearing it and having you break it down for us this way is completely different. Now there is a sense of urgency. Oh yeah, I think I've heard about that. Oh yeah, I need to make sure that my cell number. What was my cell number 3 years ago when I enrolled? Do I still have the same email address? You know, because even as we're doing health fairs here in different parts of the state, you could tell who's going to have a home number. You then learn who has a home number and a cell number, who has a rotating cell number every 90 to 120 days, or even the home address. They change that quite often as well. You know, so it's a lot harder for us to remember, well, where was I when I signed up, and do you get that information? So yeah.
And then the other thing that's tricky about it, I like how you said the word urgency, because it's also a little bit of a hurry up and wait thing, because it takes a year for the states to run through everybody. So, you know, it's hard to ask people to, like, you know, be on pins and needles for a year, because most states are going through and doing it based on the month that you enrolled. So very few people can remember probably what months did they enroll in Medicaid. But if you enrolled in February of 2021,
you know,
right. So it's not necessarily going to be your turn right away. That's the other thing. And you can't set the timetable. You can't call the state and say, I want to be renewed now. So what you can do is make sure you're findable. Make sure that the state Medicaid agency knows where you are, knows your address, knows your cell phone number. And there's been lots and lots of messaging about that, you know, but, you know, and states have different ways to make it easy. A lot of times the healthcare plans are helping, the hospitals are helping, you know, update your contact information. If you think you might have missed something, contact the state. And, you know, if you can find out when your renewal date is, great, then that's good. And it'll help you be ready, and don't disregard. And I have to tell you, there are some scammers out there. There are some people, of course, always pretending they're, you know, the state Medicaid agency. So be careful.
Like, come on. And, you know,
it's
and then,
low,
you know,
right? Always.
To prey on you, you know,
Prey on you.
Who is going to be more apt to give you their information, because this is something that they need, and you're catching them off guard. It's ridiculous.
I know. I know it always happens. Every disaster, everything like this, someone tries to scam, but, you know, so be a little bit careful about, you know, who you, what you click on. But, you know, the more important thing is to, you know, try to be findable and, you know, watch for the news.
Absolutely. And thank you so much. I want you to think of this as an extension of your office. As things unfold and you have something else that's going on, feel free to jump in the hot seat on the tandem, and let's make it happen.
Couple months might be a good time to talk about it again, because Louisiana's just started. So we don't really know how it's going yet in your state, but in a few months, we'll know a lot more. So I'll be glad to come back.
Good. Consider it done. I know you have more work to do, so I'm gonna let you chase the sun, or let the sun chase you, but either way, get after it. I love you, and there's absolutely nothing you can do about it. Thank you so much.